our group went for, perhaps it could be viewed by some as a bit of an easy option. We went for immunisation, and specifically talking from the organisation I'm from, Gavi Alliance, sort of from that perspective, because we had a very interesting conversation about how your theory of change, and especially what you might put in your impacts, might differ. So for example, what Gavi Alliance might consider an impact, if you're looking from the perspective of a country, it might actually be different. And I'll go on to explain why. So basically our inputs, our theory of change is related to the fact that providing financing for immunisations and immunising children will eventually lead to reduced morbidity and reduced mortality and ultimately improved health and well-being for populations. Our inputs were related to financing and technical assistance. Our activities included such things as training, outreach, recruitment of community health workers or health workers, and building of health facilities. Our outputs were campaigns conducted with, of course, excellent M&E in place as part of it. Number of communities reached, number of health facilities built, number of health workers recruited. Our effects, and we had a big debate about this, which I'll go into in a minute. Our effects were improved awareness of vaccinations and immunisations and the benefits related to getting your children immunised, and improved access to immunisations or health facilities. Our outcome, our main one we thought would be increased immunisation coverage, which would ultimately lead to our impact of reduced morbidity and reduced mortality. And one of the discussions we had actually several questions that we thought we could pose to the group around this. One question we had was, how far do you go with your impact? So for Gavi Alliance, for example, and this is largely, I think, probably due to our donors, we tend to stop at reduced morbidity and reduced mortality as our impact. So for our impact of what we do, that's where we lie. Whereas my colleague from Malawi was saying, well, in his country, if they were looking at immunisations, they'd probably take it a step further and want to look at improved health and well-being of their population. And my colleague from ADB was also saying, as a development organisation, they also would go this extra step. Whereas I was saying, oh, that's interesting, because we tend to stop at this level for our impact. And then also one of the questions was, how far do you go with an impact? Does it have to be clear how you would evaluate it? Because I was saying for this level of broader development agenda, I would love to hear suggestions as how you would actually evaluate that, how you would have a clear causal pathway throughout. Another question we had for the group was, we were wondering whether people in this group, when they do their results frameworks, if they always do effects and outcomes. Because I certainly, the way that I've been taught M&E, I never make a distinction between effects and outcomes. And we were wondering if people in the room always distinguish between the two. Because whereas in the ADB they do, and actually you were saying that they actually perhaps even have even more detailed results chain. I've always been used to a much more sort of high level, more like this, quite simplistic approach of a results framework, and I think it's just depending on the organisation or which country you're from or whatever. And then the final question we had was about activities and outputs, and we were wondering if the group also had a little bit of a challenge differentiating between what is an activity and what is an output, because actually we found in this results framework there's not such a big jump between an activity and an output. It's very
one-to-one correspondence.
Exactly.
Direct.
It's a direct
that makes it easier.
correspondence. So we were wondering if you'd had the same thing or whether with yours.
It looks easier, but actually when you go to the ground and do the research, getting the indicator, it's not that as easy as that, but it's easier.
Yeah.
I will point out to you later on why.
Okay. And And then the final thing we did just want to say was, you know, this was a high level. It was meant to be simplistic, whereas we were aware that lots of you were going into much more detail. But this is the subject matter that we chose, and we wanted to be a high level for immunization in general. So, comments about that? Did I forget anything?
Oh, that's nice. So, do you want to do some critics and?
Yes, let me add something.
Yes.
When your program is clear like this, you can be sure that can be implemented.
Yeah.
If you have a lot of arrows
Yeah.
going everywhere, so be careful.
That's true.
I hope we could put it there so that we could better see it. Or we don't have any masking type. They're not provided. So, do you have any comments? Something that you really like? I like the way they put it as simple as that, like, especially from the inputs up. Remember that this is a model actually, theory of change model. As simple as it gets, simple we could easily understand. It's not as easy as you may see actually when you go to the ground and implement the design, do the design implementation. It's very complicated. But at least you see the target, establish the target, articulate it. You start with the resources. How did you bridge yourself towards the target? That's the theory of the logic that you want to establish. There might be some other way of expressing it, or.
Yeah, sure.
And then I like your valid questions a while ago. Where do you start, right? What level?
Yeah.
And some suggested that you have up here.
Yeah.
We don't know the context of your company, your firm, global. What's the name?
So it's called the Gavi Alliance. And
Gavi Alliance. Yeah. So you have a lot of programs, right?
So,
Immunization is only one.
largely, nearly all are, they're all focused on immunization. They're not all direct immunization financing. We also do some health system strengthening work and support for civil
Separate
society.
program.
No, but they're all with the
Immunization.
impact focus on immunization. So outcome impact focus is the same across our programs, but the activities and the outputs might be different. But our question was, for the impact, do you have to know when you're producing your theory of change model, do you already have to know exactly how you'll be able to measure things? Or, because we were struggling with this question of, how would you measure immunizations, the contribution towards improved health and well-being?
Well, there are a lot of, a lot of things involved in the design.
Sure.
Design. So, when you put this impact and granting it to its valid, there must be a way of measuring it through the indicators, not necessarily measuring the impact itself per se, right? But there must be, like this way, improve health well-being of the people, for example. That's a valid goal, valid target. Now, if that's the articulation, how do you go about? How do you go about measuring that? The
I think here we were on the Gavi Alliance shoes,
Yeah.
whereas they would like to be accountable for this specific program of immunization.
Specific people, setting.
Yeah, with specific program,
Yeah.
targeting, in a country,
Yeah.
the under 5 populations probably, and get them immunized, and then see afterwards, after 5 years, that get mortality rate or morbidity rate improving. Okay, and that's their job is done.
Yeah.
But for a development institution like us,
No,
we
higher
cannot
level
stop
impact.
there, because
Yeah.
although we see that we are improving, these are improving, but the question is, are we serving our mandate?
Yeah, that's
So it is linked to our mandate, and that's why here we are introducing the institutional context of the intervention. So, and for the country recipient, it's even deeper,
Yeah.
because for them, and the colleague has explained, that they have a development plan, whereas this immunization is part of a bigger,
Okay. Okay,
poverty
consider part.
reduction program, PRSP, and so even for them, this is
This
should
is
be part-
achievable. This is an achievable
Yes,
target.
it is
yeah.
part of their development
Yeah,
program,
the model.
on which we as
And there is a way of measuring.
yes,
Through indicators.
yeah,
Because you could identify your recipients, right? The beneficiaries. And you could make a follow-up, for example, research on how it improved their lives, their well-being. And well-being, of course, you have to qualify what is well-being to you as people who measure, right?
So the colleague from Malawi is asking, is there any way to help the government assess, the impact of the immunization program for them?
There's a way.
Because actually, it's not really.
That's our job.
I mean, yeah. You see,
That's
that's
our
their job, their
Yeah, it's our
concern
job
actually.
to put in place through research, our design.
Yes.
Because you could identify the people, the setting, right? Time, the resources that you use. Based on your design of the research, depending on what tools you would use, you could identify the treatment group, if there is a treatment group, and so on, depending. And then, based on your questions, evaluation questions,
Yes.
maybe attribution questions, cause and effect, something like that. You could very well focus on the beneficiaries,
Yes.
what happened to their lives. If it were not for the program, how would they be counterfactual?
So the uptake here is that the theory of change from a donor perspective is probably limited
Yeah.
compared to the theory of change from the government or the authority perspective or the country, because they are of different,
Yeah, I'm also
community
wondering
reasons.
about how do you make the impact realistic? Because now, given that there are other maybe key players, for example, let's think of mortality. Yes, mortality could be due to lack of immunization, but it could be due to lack of other things. So now, if I personally developing the theory of change, assume that if I've done issues around the immunization, I'm going to reduce mortality. It may not work.
There
Because
might be some, you mean there might be some causes of mortality? That's true. That's the part of the research.
So
part
that's
of evaluation.
why I'm saying, I think in developing the theory of change, we need to be realistic in terms of the interventions that you are putting into. Because you may develop something too general, and when you come to evaluate, you are completely off the point. So I
That's the
think
strength of theory of change.
we need to be very realistic on such.
And that's why it is based on the design of your program.
Mm.
Remember that we're talking here, design of the program could be the design of the evaluation. Those are two different things, right? If the program is badly designed,
Mm.
it's very hard sometimes to do an evaluation. Yes,
Background is Argentina healthcare insurance, the program. Is in the public sector. We have in Argentina 24 provinces and 7,000 healthcare providers in the public sector. The population target of the program is over the 9 million people. We have children, teenagers, and women until 64 years of age. The background model is there. The nation transfers money to provinces according to amount of people enrolled. It's the simplest model, and provinces pay the money to healthcare providers according the healthcare service provided to the population target. No. Okay, the beneficiaries of the program. Okay, we chose the result-based and monitoring evaluation approach. Okay, we have inputs, activities, output, outcomes, and impacts. In inputs, we have the budget is $1 million. No, 1 million. 1,000 million is a big amount of dollars. The providers network, the staff in the national level, province level, and provider level. And the information system is very important to make the transference based on the information. Activities, we have training and management tools for the providers, communications, campaigns, dissemination, and capacity building as a whole. There are many activities in order to improve the capacity building. The capacity. Okay, so in outputs we have without the number services provided, people enrolled, and develop the information system development. Outcomes, we have the beneficiaries, health results, healthcare provider staff satisfaction is a very important result, outcome, beneficiaries satisfaction, and healthcare network coordination, because is an objective of the program as well. Finally, impacts. The capital human increased can be one impact. Well-being of target population improved, and healthcare network improved. There are three impacts we noticed of the program.
Okay, very nice, right? I like the way you put the background, the context.
Yes,
of it.
yes, because it's important.
Very
to
concise, but
understand.
we got a lot from it, right? And also the way you innovate the layout. What do you think? You have questions? Maybe my point, I would like to point out some of the articulations that you could make it more maybe unified. For example, here, maybe you could do some more analysis. Capacity building, training is part of capacity building.
Yes,
That,
yes,
right?
yes, yes.
And what is this management tools formulated or designed or?
Formulated, implemented.
Even guidelines.
Dissemination and communication, are they not the same? Maybe a different one.
Dissemination is a part of the
Communication.
communication, I think. Yeah.
So you could still revisit that.
Yes.
But we discussed that somehow when we produce a lot of reports during the program, so you should use them also during the program. That's why the dissemination is
Dissemination
based,
is different from the
yes,
communication campaign. Okay.
and it is somehow a activity
Ah.
during the program.
So dissemination will be part of the research and development. Is it this, right?
Yes,
Dissemination.
it's to improve
For
the
example,
management.
good
It's to
practices,
improve the
yes,
management.
or something else.
side.
And if you write those reports, but nobody uses them, that's you should also to interpret with all those who has produced the data for the reports, and then understand more and go the next level and so on. So use the reports during the development work.
Okay.
That's why we put it there.
Now in the outputs, you have you came up with outputs. Actually, there might be some more. Service provided.
Yes.
People enrolled in the training, or people
No,
trained?
in the program.
Ah, okay, in the
It's a
program.
program.
Okay.
It's an
People enrolled.
insurance
Okay.
program.
Information system developed or not
Developed.
Yeah.
Developed. Yes.
Mm. Now, in terms of the outcome, beneficiaries, stressful health results. What do you mean by results? Maybe a bit. Maybe you could articulate
Yes.
it some more.
Health results.
Improve health among
improve
beneficiaries.
health.
Yes. Okay.
Yes.
Could be HPC staff satisfaction. What increased satisfaction among so-and-so, maybe.
Yes, is a
No,
is a
why
result.
you could see there is all again a lot of redundancy in the way improve, strengthen, maybe increase, always like that. I avoid using enhance. A bit difficult to qualify the word enhance. I would better use improve. Why do we express it in the way of distance, for example, past tense? Because a goal, we put ourselves in in the state that we achieve it. That's why we measure. Yes, we make believe that it's already done. That's the convention that we want to put in place. Increased already in the past tense, meaning as if it's already achieved. That's why you're doing the measure. Look at the convention, right? That's why here, when we say increase, remember that the key or the core idea in intervention is change, right? Change, we are always after change. So when we say increase, that means you have the baseline data, 20%, after 2 years, 30%, there's an increase. But when we say only satisfaction of the people, yes, you're satisfied, but it does not imply change, right? So it may be redundant, it may be a little corny, but I think that would help in terms of articulation.
I think the big question here is to have an idea about the change actually. What is the theory of change?
Yeah.
So you have healthcare providers,
Yes.
okay, and you have beneficiaries. So what is the change that you are going to make?
The healthcare providers are supposed to have better conditions to work and give the incentive and motivation to work better, and so the health result of the population, in this case the beneficiaries, is improved as a result of the way to work.
What is the difference between healthcare providers with health centers or are located elsewhere? Not really. Rather than the healthcare providers will go to the beneficiaries, the beneficiaries go to the health centers.
The beneficiaries, both. We pay to healthcare provider to go and search beneficiaries and get the service, healthcare service to increase the health results of this case, that beneficiary.
So which means that your beneficiaries, rather than to go, they will have healthcare providers.
Yes, but the core of the program, I think, is the staff satisfaction with increased level of staff satisfaction in the healthcare provider. People will work better, and they have capacity, skills. They have their
Implementation of the
yes,
program.
yes.
But
The motivation is what provoked the
So
change.
the program, the theory of change is that to make your healthcare providers
It's
much
based-
more
it's-
motivated,
it's
able
based
to
in-
provide the
in-
services
the
that
program-
were expected to
Yes,
deliver.
the program is based on incentives. It's the main.
Now it is clear. The
The
theory of
main,
change is
the
less
main,
clear.
yeah, the main word, more important, is incentive in this program. The person who change the result is the person who gets the money. As simple as.
So that's why I'm coming back here to the beneficiary satisfaction is really an outcome because of the change of the behavior of the healthcare providers.
Yes.
And then you get it, it's not,
Yes.
the ultimate objective is to improve the health, but also before that, we need to get satisfaction
The
because
satisfaction is important.
it's important
as well.
element, an outcome from the incentive program that it is put in place.
improve health well-being, right?
Yes, it's related
To
to
me,
improved satisfaction.
What do you think? If we use the satisfaction rating as an indicator of improvement,
Of the incentive
that could
program.
be right.
Let us be clear, of the incentive program,
Yeah.
that it is put,
Such that
the-
what I mean is you could still make it compact.
yeah,
satisfaction rating or increase in satisfaction could be an indicator of improved well-being. Would you agree with me?
And there are also there are also some indicators which are hard to measure. For example, happiness. How do you measure that I'm happy? Or satisfaction. I think maybe we also have to be very realistic in coming up with some of the impact statements. To me, I think that one may not have
You know,
much problems according to their context.
Bhutan now uses happiness index as indicator.
Yes, of course. Quality of life.
Meaning that you could measure.
Mhm.
Depending on the parameters that you
Yes.
set, you agree that this one.
Mm.
Happiness could be measured. Just like resiliency. Depending on what.
Well-being depends on many other interventions, not just
Yes.
of this program.
Yeah. So here, satisfaction could be a part of the indicator. Now here, HC network improved, well-being of the target population improved,
Yes.
but here you have already, you have beneficiaries health improved, right? Okay, here you are talking of well-being.
Here-
Okay.
Well-being is
Well-being would be more,
yes,
Yeah.
broader.
here more of the health. How about the capital, increase human capital,
Yes.
human resources?
And no, in the at first this program was focused in children, because the children have are the future. So we suppose that this kind of
Okay.
program.
If the well-being
go
of the
to-
people,
to-
especially the
to
young people,
children.
improve, that
Yeah,
means
because
it increases the
capital
resources,
human.
human resources.
Yeah.
it-
Oh, okay, I do that.
better health results means
Because we have to be clear with that, because we want to establish which is the prime impact, right? The level. Will it come on the top or later? So here you have 3 impacts.
yes, at least.
3 impacts. You get 3 indicators for each or 4, you have 12
No.
indicators, main indicators already
Indicators.
here.
We have indicator for the ease or the impacts.
All of this would have indicators actually.
We need indicators for
Inputs,
impacts.
outcomes, effects. Then
Do we
effects,
need
outcomes.
indicator for impacts?
Yes,
Okay.
there should be, because those are results. Otherwise, how do you provide proof that you have attained the objective or the goal? That's the issue now, or making logical the ToC. We have to provide the evidence, the proof that we achieved that.
But here again, we need to distinguish between, to be clear, between an effect
And outcome.
and an impact.
Yes.
Because
Yeah.
through outcomes.
Images and long term.
Yes.
That will
Because
bring
here,
it.
yes, absolutely. The network improved
Yeah.
may not be seen as a long-term effect, or
It can be here.
you see, yeah, it can be really as probably an
Intermediate.
intermediate or intermediate, rather than an impact. And this is something that
I can measure the impact maybe, but I can't attribute that impact at the program, because it's a product of many other interventions, well-being of target population. No, it's not because of
You
the
mean
program.
these 2 impacts?
Yeah, the impacts.
You could not measure it in your own level because there are many that contribute to it.
Yes, the attribution is more difficult.
Well-being. How about, the beneficiaries? You run a survey, you run a case study, you do a case study, you run an interview, and then you propound the questions of attribution. You could do that, I think.
Attribution.
Cause and effect question. Maybe to the beneficiaries and the health staff. And then some other organization could. Remember, this is very complicated, right? But we could not find it in the evaluation report. We do not put the indicators maybe in the annex, right? So it's an issue again of synthesizing what you have found out here and then put it in the evaluation report.
I mean, here theory of change assumes that through an incentive program, through training, communication, capacity development, we increase the level of, say, you know, for these networks, for this satisfaction, the level of satisfaction of the services provided, and finally get better results in terms of healthcare, human capital, etc. But there are some other things that can be also as incentives, okay, for this service provider, and it could probably from the public health policy that will encourage, for example, by giving material or financial incentives, car, a bike, or whatever. And I think that this is really what happened in some of the African countries, where we give, you know, bikes, you know, to go and you know, ask questions, do surveys, and take care of you know, of kids for this immunization program, etc. So this is also some part of, you know, working conditions. It's not only incentives run through training or awareness. It can be something else.
Context matter.
Yeah. I think the theory of change is solid. That you presented like this is solid. But you need to really make sure that we don't
Confuse it.
yeah,
Yeah.
or pack all impacts all together,
Yeah.
because there are long-term impact which has really very
Yeah, there are
important
long-term
impact.
Okay. I think you could do that later on. And move on to the course identification of indicator. You know, well, this morning we posed the tolerance, the Czech Republic, right? You know what indicators we looked into to show increase in tolerance among the students or communities, or say in the Afghanistan, IBAO, for example. We look at some kind of indicator, mixed gender, mixed sex interaction, for example. Could be there are events in the villages, something like that. In the Czech Republic, maybe cultural events, the increase in cultural events, maybe. That means that helps in the increase of tolerance.
Or
So
decrease-
you could be very
decrease of
creative
racial-
in identifying
Increase of
indicators.
racial crime,
Yeah.
for example,
Yeah.
or
Yes.
but for the I mean, for this kind of program where we are talking about motivation,
Yeah.
I think there is a research on that, because incentives, there are some incentives which may work as disincentives, actually. People, you know, get trained, but don't do so much, because even though we gave them, you know that
They don't develop the
this
skill and process it.
Maslow,
Yeah.
you know, type, you know, of behaviors that would probably differentiate the role of,
This time.
yeah.
Okay, so. Okay, I think we could move on to this group.
Well, first I would like to explain that we started identifying the problem that is not written here. And our analysis started with the explanation of the problem, which is that there is a high mortality rate due to preeclampsia in pregnant women in Bangladesh. And some of the context is that they live in villages and they don't go to the doctors. They are being treated by TBAs, who are women who help them with the delivery. And what else is important in the context? These women are old and they help them only with the delivery, but they don't have any treatment during pregnancy. Okay, so that's the important context in this particular case. And then we follow with the analysis of what are the conditions that we would need to have many years after the project is finished, okay, to reach the final goal, that is the final goal is that the mortality death rate of women with preeclampsia have reduced. So this is the final goal. So we see which are the conditions, meaning the assumptions. Okay? So we did analyze that, and then we decided, okay, if the assumptions that are not written here either, because it was a part previous, we decided we needed some to work with specific groups. Okay, and for example, well, this is part of the existing project, so we say we, but it's already thought. So, which are the groups that we need to work with? Community level, which are the leaders of the community. Because if we want to implement a new process, a new mechanism, we need to be accepted by the community leaders, so they would induce the population to accept it. Okay? So here, the community level, here is to have volunteers groups that work directly with women during pregnancy, and here is to work with the existing TVA, which are women that are old and they're doing something else, but they are very important in community and with pregnant women, so if they would oppose, the project would fail, okay? And also we need to work with actual women and inform them, etc., and to work with the government to have continuation after the project is finished. Okay, so once we identify the groups, we said what do we need? First, to build a community, at the community level, the leaders, we need to build a support group, okay, of the leaders, of the support group of the project. And we find the output for that, the indicator, is the number of the community leaders that are involved in the support groups, and because there are some villages, is the number of support groups, correct? Yeah. Here, so we have as well to recruit. It's a whole bunch of activities here, but it deals with recruiting the voluntary members that are going to work with the communities, to train them in the methodology to identify preeclampsia, how to treat them, and how to take women to the health centers. Okay, so as an indicator, we have the number of volunteers that will be involved, and here as well to identify all the TVA women, and again to train them and to convince them that it's a good thing, that this program is not going to interfere with their current job, and it's not going to make a competition, it's going to help them. Okay. And here we have many activities dealing with women. So we found different levels. First, to provide general information to women that are 10-year-olds and older, for example, in the schools and things like that. And to go, they will go, the volunteers, these volunteers that are being trained here, they will go to each one of the households, providing information to each one of the women, telling them how to, first of all, to identify which women are pregnant. And second of all, to explain them of the disease and how to face it, and that they should go to the doctor, and also to give them the first treatment. Because if they don't receive a very fast treatment, they could die, they don't have time to reach to the health center. Okay, so but the women need to know that. So this group of activities is to train the women. Okay, identify and train the women, and so we have indicators, number of women, pregnant women that are being identified and that are trained and that accept the mechanism, and the number of women that go to the health centers. And here, that is the work of the government. With the government is also is activities to create a mechanism to work or channels to work with the government, to have them involved, and to have a plan that will include, to have a plan of how to include in the governmental work this kind of similar activities, or activities that will support or be complementary to this program, okay? So, here we have then the effects. We divided them by groups, and the effects as well, to have continuity, we have identified them as well. Just distinguish the colors. So, for the effects, we will have, I cannot read that now. So we have developed the activities, which is to identify and to train the people, and here we have the effects that are the community leaders are aware of the problem and are willing to support the program and are willing to support the volunteer leaders and to convince the community to support it. Okay, and here as an indicator for this, we put additional columns, okay? Because we wanted to put some, this is an example of an indicator. The increase of knowledge of the community leaders, the increase of awareness, the increase of motivation. And here we have, when we talk about recruiting volunteers as well, we have good institutional structure of, in terms of an institutionalized group of volunteers that has been created here after we have trained and we have given them skills. Again, as an indicators, we have increase of motivation, increase of the skills of volunteers, and so on. And here with the TBA as well, here with the volunteers still we have increase of skills, increase of motivation, increase of willingness to work with the mothers, okay, during the project and hopefully after the project. Here with the TBA as well, we will have the awareness and acceptance of the TBA woman. And the effects will be as well the pregnant women are willing to, are aware as well. So it means an awareness and willingness to work. And in the effects on the governmental level as well is to have governmental disposition to work and also to have the plan that we built here, that the plan is being incorporated and accepted by the government and is incorporated into the national health system. Okay? And as a general outcome here, so we first we were thinking that the program, the actual activities and effects of the program finish here. And this will be an intermediate state years later, and the impact will be many years later. So here as an intermediate state, we have the existence of a structure that involves community leaders, volunteers, the TBAs, the government, okay, that all together will contribute and continue with the process many years after the project is finished. Okay, and the final impact with all this would be that the death rate of pregnant women would reduce, or due to preeclampsia, is decreased drastically.
Thank you. So, do you have any comments?
One more thing, just one thing, is that we were discussing about the names, effects and outcomes as well. And because of methodologies actually and the general logical framework, we found here outcomes. And here we call it intermediate state in many other, but it's just name.
You mean in immediate, intermediate, and long term? Is that the one?
Intermediate state,
Could be,
and this is very long term.
yeah, it could be long term, intermediate, and immediate.
Yeah, I mean,
Depending on your convention.
intermediate,
That
yeah.
you okay. So you have attempted to put already the indicators there, right?
This as an example.
Actually, that could be good. When you have established a good ToC model, you could move on to identification of indicator. But here, for the sake of, I think, presentation, you just put it. One thing, it may be your own way of establishing the rule or convention in your own group, right? You use statements, complete statement, to develop, for example, to develop is an expression of objectives, right? Yeah, if you want to,
To establish.
maybe you could still improve that and shorten it in a way.
Yeah. The wording.
Yeah. And then in the outputs, so just the same comment. Maybe I would suggest you do away with the number or the expression of indicator at this point because you're dealing with the output. When you say the number of so and so, you're already expressing it in terms of indicator.
Yes.
Yeah. So I would suggest do away with the number